Hello, I'm Susanna Hopsalerin with Hospitals and Health Networks magazine. Today I'm joined by Rich Schaefer, Vice President and CIO, and Rick Chesnos, Senior Vice President and CFO at St. Clair Hospital in Pittsburgh. Welcome.
Well, thank you very much, Susan. Pleasure to be here.
St. Clair wanted to develop a tool for patients to become more savvy consumers of healthcare, not only costs, but also looking at quality. And you conducted a focus group. What did you learn?
Actually, the first step in our process, Susan, was to extract data that we've been receiving from our patient phone calls. Patient would phone into our patient access area to ask what their particular procedure may cost. From that, we've learned that patients wanted a more convenient way to access that information. We'd also provide them with estimates over the phone prior to their service. However, now we were looking at a way to provide information to them in a very convenient fashion, available to them 24/7. So then we started to work with our existing vendor and to develop the web-based tool. From there, we were able to develop the interfaces with the insurance companies to put this information out on the web. Then we brought in the patient focus group. The patient focus group really enabled us to develop the final product for our tool. And what we learned from that patient group was really keep it simple. The patients wanted to know the information that was essentially on their explanation of benefits, also known as EOBs. Nothing more, and their focus was really on what was their out-of-pocket cost going to be. And we were able to provide a lot of changes based upon that feedback from our focus group and develop what we believe is a very fine product.
And I think the focus group also gave us the feedback necessary that our thoughts that this tool was needed and wanted by the patients, by the consumers. And once they were prompted for that, overwhelmingly they came back and said, yes, that's a tool that we want.
How does this tool actually work? It's housed on your website. It's available 24/7.
The tool itself is very easy to use. The information that a patient enters is basically the same information that's contained on their insurance card. From there, the tool goes out to contact the insurance companies via the internet and verifies the coverage along with their benefit information. As it's doing that, the patient is selecting from 14 different categories of test and then the specific procedure that they are looking at price for. And they acknowledge that this is an estimate only, and they go on to the next page. And through the processing that goes on behind the scenes, the information about what their insured allowed amount, what their deductible, coinsurance, and their total out-of-pocket cost is there for them.
And I think it's important to note it's also very easy to navigate. So we get very, very few questions about, what do I click next or what do I fill in? Very intuitive. And the other key feature, it's fast. So they're not waiting. It's not sitting there with the hourglass tilting around. It's very rapid response.
Were there any challenges that you encountered in really kind of advancing this price transparency? And I'm curious, did you have pushback from some of the insurers?
Well, there was a tremendous amount of work went into this with a multidisciplinary team, including the clinicians. As you well know, the nomenclature we use in healthcare may be foreign to the regular patient. So that again is where the patient focus group came in, so that we were able to verify what we wanted to call our test, what the information that we put regarding deductible and coinsurance was very accurate. There was a tremendous amount of work, though, done in the testing. We had to test every insurance product. We're insurance agnostic, so any insurance plan that we participate with is included on their drop-down choice from the insurance cards that they have, along with all the insurance products. So out of 105 different procedures, we had to multiply that by the number of insurance products. So there was almost 2,000 hours worth of testing done by our staff.
And it sounds like a trivial thing, but finding enough access and enough contiguous hours for staff to perform that much testing is a challenge. Can't occur just in their normal workspace. So we configured special IT training rooms where they would be sequestered and they would get large chunks of time to just go through all these volumes of tests.
How has this tool been received by the patients?
The feedback has been extremely positive. Again, as patients have previously accessed our site for quality information, patient safety, and patient satisfaction, now they can access it about their cost too. So it really gives patients an insight about the value that St. Clair provides them. And one other thing that we really found very interesting is that our physician offices are using this. As we spoke to our employees about this tool shortly after we launched it, one of our physician office managers stated that they used the tool in their office whenever a patient asked them, how much is this test going to cost me, that the physician just wrote this prescription for. And so we found that this has really opened our eyes to a way that we can utilize this to increase patient compliance with their patient ordered prescriptions.
We know that before the online tool was in place, there were about 16 estimates per week that would come in via phone. Now we know that we're at 105 with the combined phone and online access. So that tells us there was about 90 patients per week that had a need or a desire for a patient estimate that weren't getting it. And now it's very satisfying knowing that we've got this much, much larger volume of estimates going out and, the consumers being informed with the information they need.
Thank you. I'm Susanna Hopsahlern with H&HN. Thanks for watching us.